A recent study suggests that incorporating olive oil into one's diet could help reduce the risk of death from dementia.
Yeah, here to tell us more about that is Dr. Zorba Paster.
Yeah, olive oil is great. Do you use olive oil?
I cook with olive oil all the time.
Yeah, so a tablespoonful every day turns out to be probably the good amount to eat. So this particular study looked at death from dementia. It looked at roughly 90,000 people over a 30-year period and looking at what they ate. So these are diaries like what are you eating for breakfast, for lunch, for dinner, how much butter, how much margarine. And they found out that people who consumed roughly a half a tablespoonful, that's all, to a tablespoonful of olive oil were 28% less likely to die from dementia and problems with dementia. And this may be due to a bunch of things. We discovered in the Mediterranean diet that olive oil is a key issue with the reduction of heart disease and stroke. And there must be something, antioxidants in olive oil or something that actually does something good for us. And we don't quite understand it, but it's Mother Nature's superfood is olive oil.
How about olives?
We like it. Oh, olives would be just fine. I don't know how many olives you would need to have a tablespoonful of olive oil. I would ask Google, and she would tell me how many, but olives have olive oil. That's exactly it. But olive oil is concentrated.
I live on olives, too.
You love olives.
Well, I live on them.
Olives are a little bit salty, though. You know, olive oil is not.
Yeah, it's the martini. Well, we'll leave the martini part out.
Well balanced.
So anyway, we just had this 93-year-old man.
Right.
Longevity.
Yeah. Well,
you've been looking at this quite a while.
For a long
Why
time.
does somebody live to be 93?
Well, first of all, there are genetic celebrities. In other words, some people look better, feel better, and are better. So genes really play a role. Well, you can't change your genes. But what can you do to actually live longer? Well, first of all, exercise every day. It's a big issue. Eat right, cut down on saturated fats, eat right, lots of fruits and vegetables. And then part of that also is your social relationships. So look at that story. I mean, he didn't do it alone. He did it with his family.
His son and granddaughter?
That is such a major thing. I mean, all we have to do is think about COVID and all the trouble with COVID where we couldn't see our family, we were in a bubble. So social relationships lead you to better longevity because you want to live longer. And when you want to live longer, you take the right steps. And I think that's a major issue we don't think about. We know that hermits, people who live alone, generally live a shorter life by anywhere between 2 to 5 years. And why? They just don't have those relationships.
So having a purpose, that can be a big...
You hit it. You hit it. And having a purpose also means having a purpose with other people. You want to live longer, so you're more likely to take the right steps to do it, because sometimes eating kale is not as much fun as eating steak. I mean, I love a good steak, but I don't have a steak, obviously, every day, and I have lots of fruits and vegetables. Only 1/3 of Americans, between 1/3 and maybe 40%, get 5 servings of fruits and vegetables a day, and a serving is like, we're talking about like a half a cup. We're not even talking about a lot. So a lot of people just don't eat the right stuff. And when it comes to eating vegetables, the fried potato is not the best vegetable to eat.
What?
French fries. French fries don't really
We're bearing the
count.
lead here. And there's other things you can do that you shouldn't. Smoking, heavy drinking.
Well, we're down now to about 14%, between 12 and 14% of the people in Wisconsin smoke. Our numbers are down, but it's still 12 to 14%. Having a drink a day is fine. 2 drinks for men, 1 drink for women. Not binging on the weekend. Very important issue. And so eating right, exercising right, doing all the things that we know to do. And then, of course, getting immunized the right time, wearing a mask if you're actually sick, all those other things that make sense. People don't take their health seriously, and sometimes they don't think they can actually make a difference. And the answer is yes, you can make a difference.
And you said there's a little spike of COVID going around or something?
Yeah, there is a spike of COVID now. And I think COVID is here forever. It'll be here forever. And it's just like influenza. So what you should do, especially, no matter what you should do, is stay immunized. You know, in September, I'm going to get my flu shot and my COVID shot. I'm going to do that every year. And stay healthy. And if you're older, over the age of 65, and you're not immunized, and there's still people that are not immunized, roll up your sleeve and get immunized. That's your best way to take care of COVID. And the RSV shot, which is now available, I believe now or soon available for adults, will help 15,000 American adults die a year from RSV. So we don't even mention that. If you had RSV and you had influenza, you're looking at roughly about 70,000 Americans who don't have to die because they can get immunized, most of them.
Our crack research department tells us it's 20 olives for
it's 20 olives
for a teaspoon of olive oil.
Do you get that many?
I don't eat 20.
That's too many.
Wouldn't that be too many in a martini?
That would be like 10 martinis, and that's probably too many.
I can't do olives, but I do like olive oil. I use it.
Yeah, there is
for
a real
everything.
difference because olives are salty.
Yeah.
You know, they're different, and olive oil is easy to use on a salad every day. Just put some olive oil on your salad.
And I
It's a
know
good
someone
way to
who uses it as like a face moisturizer.
Oh,
and like
yeah.
her skin is
Yeah.
smooth and.
What's her name? Olive?
Good.
Zorba, thank you.